Folinic acid, Wikipedia audio. Folinic acid, also known as leucovorin, is a medication used to decrease the toxic effects of methotrexate and pyrimethamine. It is also used in combination with 5-fluorouracil to treat colorectal cancer, may be used to treat folate deficiency that results in anemia, and methanol poisoning. It is taken by mouth, injection into a muscle, or injection into a vein. Side effects may include trouble sleeping, allergic reactions, or fever. Use in pregnancy or breastfeeding is generally regarded as safe. When used for anemia, it is recommended that pernicious anemia as a cause be ruled out first. Folinic acid is a form of folic acid that does not require activation by dihydrofolate reductase to be useful to the body. Folinic acid was first made in 1945. It is on the World Health Organization's list of essential medicines, the most effective and safe medicines needed in a health system. In the United Kingdom, it costs the NHS about £4.62 per 30 mg vial. Medical use. Folinic acid is given following methotrexate as part of a total chemotherapeutic plan, where it may protect against bone marrow suppression or gastrointestinal mucosa inflammation. No apparent effect is seen on pre-existing methotrexate-induced nephrotoxicity. Folinic acid can be taken as a pill or injected into a vein or muscle. While not specifically an antidote for methotrexate, folinic acid may also be useful in the treatment of acute methotrexate overdose. Different dosing protocols are used, but folinic acid should be redosed until the methotrexate level is less than 5x10^8 m. Additionally, folinic acid is sometimes used to reduce the side effects of methotrexate in rheumatoid arthritis patients. This includes reductions in nausea, abdominal pain, abnormal liver blood tests, and mouth sores. Folinic acid is also used in combination with the chemotherapy agent 5-fluorouracil in treating colon cancer. In this case, folinic acid is not used for rescue purposes, rather, it enhances the effect of 5-fluorouracil by inhibiting thymidylate synthase. Folinic acid is also sometimes used to prevent toxic effects of high doses of antimicrobial dihydrofolate reductase inhibitors such as trimethoprim and pyrimethamine. It may be prescribed in the treatment of toxoplasmosis retinitis, in combination with the folic acid antagonists pyrimethamine and sulfadiazine. It has been investigated for use in Down syndrome, but a benefit has not been demonstrated. Folinic acid should not be administered intrathecally. This may produce severe adverse effects or even death. Fluorouracil. Folinic acid may increase the toxicity associated with fluorouracil if the two are administered together. Some adverse effects that have occurred, particularly in elderly patients, include severe enterocolitis, diarrhea, and dehydration. Sulfamethoxazole trimethoprim. A potential drug interaction exists with concomitant use of sulfamethoxazole trimethoprim and folinic acid. Folinic acid has been shown to decrease the efficacy of sulfamethoxazole trimethoprim in the treatment of pneumocystis jirovecii, a common cause of pneumonia in AIDS patients. Side effects. Folinic acid is a 5-formyl derivative of tetrahydrofolic acid. It is readily converted to other reduced folic acid derivatives, thus has vitamin activity equivalent to that of folic acid. Since it does not require the action of dihydrofolate reductase for its conversion, its function as a vitamin is unaffected by inhibition of this enzyme by drugs such as methotrexate. This is the classical view of folinic acid rescue therapy. In 1980s, however, folinic acid was found to reactivate the dihydrofolate reductase itself even when methotrexate exists. Although the mechanism is not very clear, the polyglutamylation of methotrexate and dihydrofolate in malignant cells is considered to play an important role in the selective reactivation of dihydrofolate reductase by folinic acid in normal cells. Folinic acid, therefore, allows for some purine/pyrimidine synthesis to occur in the presence of dihydrofolate reductase inhibition, so some normal DNA replication processes can proceed. Folinic acid has dextro and levorotary isomers, only the latter one being pharmacologically useful. As such, levolucovorin was approved by the FDA in 2008. Folinic acid was discovered as a needed growth factor for the bacterium Leuconostox citrivorum in 1948, by Soberlich and Baumann. This resulted in it being called citrivorum factor, meaning citrivorum growth factor. It had an unknown structure, but was found to be a derivative of folate that had to be metabolized in the liver before it could support growth of L. citrivorum. The synthesis of citrivorum factor by liver cells in culture was eventually accomplished from pteroylglutamic acid in the presence of suitable concentrations of ascorbic acid. The simultaneous addition of sodium formate to such systems resulted in increased citrivorum factor activity in the cell-free supernatants, and from this method of preparation of large amounts of the factor, its structure as levofolinic acid was eventually deduced. Folinic acid should be distinguished from folic acid. However, folinic acid is a vitamer for folic acid, and has the full vitamin activity of this vitamin. Levofolinic acid and its salts are the 2S form of the molecule. They are the only forms of the molecule that are known to be biologically active. It is generally administered as the calcium or sodium salt, sodium folinate, leucovorin calcium, leucovorin sodium. Drug interactions. Mechanism of action. History. Names.